You count on Native Voice One for Indigenous music and stories. Now, NV1 is counting on you. Our spring membership campaign is happening now through May 3rd. Please donate today to empower Indigenous-led media and ensure Native stories continue to be heard. Thank you. Welcome to Native America Calling. I'm Sean Spruce. Cherokee Nation Principal Chief Chuck Hoskin Jr. says if Oklahoma lawmakers go through with a proposal to slash Medicaid access, it will cut health care access disproportionately for Native Americans. He also says it will gut his own tribe's health system. His comments on the House floor got him banned from speaking there in the future. We'll speak with Hoskin and others about what looming changes to Medicaid could mean for Native patients. That's coming up after the news.
This is National Native News. I'm Jill Freitas. Efforts to find a missing Alaska Native college student from the Bering Sea community of Shaktoolik are over. After almost 4 months, the remains of Kelly Hunt were found in a wooded area in an Anchorage neighborhood. KMBA's Rhonda McBride reports.
Although the search for Kelly Hunt ended in a ravine where she was found last week, the search for answers goes on. The 19-year-old's remains were discovered not far from a home she'd been staying in when she stopped to visit on her way to attend college in Soldotna. She was last seen on the morning of January 7th. Her family reported her missing 4 days later. Advocates for missing and murdered Indigenous people have questioned the police's response.
Far too often, when a young Alaska Native woman is reported missing, it's too late, and we are now looking at human remains.
Michael Livingston, a retired Anchorage police officer and MMIP advocate, says Hunt's case reflects a pattern he's seen all too often. He says several red flags in Hunt's disappearance should have prompted a more aggressive investigation. He says Hunt had left her purse behind with money inside, as well as clothing, signs she didn't plan to be gone for long.
Was there any more that anybody could have done to try to have located her early on in the game, to see whether or not any video surveillance cameras or people in the neighborhood might have seen anything suspicious?
Livingston says he would like to see an investigation into the police's response. Anchorage Police Chief Sean Case says he would be happy to discuss this with advocates, but for now, he says the ability of investigators to talk about the case is very limited.
The problem is that can really cause challenges if it does become a criminal investigation later on.
Case says one of the difficulties police faced was the 4-day gap between the time Hunt went missing and when her disappearance was reported. He says he doesn't blame anyone for the delay, that there were apparently reasons for that.
But as soon as we found out that she was missing, we took the report and detectives took over that case and treated that case as a critical or a high risk or a case that there was definitely concern over.
Case says investigators continue to process evidence as they wait for the chief medical examiner to determine the exact cause of death. So far, no arrests have been made. In Anchorage, I'm Rhonda McBride.
Governor Katie Hobbs signed a bipartisan bill into law earlier this month, mandating that the Arizona Department of Child Safety make attempts to enter cooperative agreements with each of the state's 22 federally recognized tribes. KJZZ's Gabriel Pietrasio has more on the measure meant to improve child welfare.
The statute requires DCS to identify a liaison for each tribe, who is then responsible for providing technical assistance and coordinating communication. The agency will also share best practices, policies, training materials, and operational standards. Murdered San Carlos Apache teen Emily Pike was in the care of DCS when she went missing from a Mesa group home for the last time in early 2025. Her tribe has yet to enter an agreement with DCS, but is in talks. To date, only 4 tribes have established such MOUs. For National Native News, I'm Gabriel Pietrorazio.
I'm Jill Freitas.
National Native News is produced by Kawanak Broadcast Corporation with funding by the Corporation for Public Broadcasting.
Hear that? Tribal college faculty do so much, one can't say it all here. Nothing but respect. Visit mostthoroughdescription.com. The American Indian College Fund supports this program.
Support by Sonosky Chambers Law, championing tribal sovereignty and Native American rights since 1976. From opioids litigation to treaty rights to tribal self-governance. With offices in Washington, D.C., New Mexico, California, and Alaska. Sonosky Chambers Law.
Native Voice One, the Native American Radio Network.
This is Native America Calling. I'm Sean Spruce. Cherokee Nation Principal Chief Chuck Hoskin Jr. warns that looming changes to Medicaid coverage would immediately reduce health care access for 250,000 residents in his state. He is referring to efforts by the Oklahoma legislature to move Medicaid benefits decisions that state citizens enshrined in the Constitution in 2020 into state statute. This would enable Oklahoma lawmakers to make Medicaid policy changes or scale back eligibility without voter approval. The change could cut health coverage access that tribal citizens rely on. The state's proposed shift comes as the federal government is cutting funds and adding restrictions to Medicaid coverage beginning in January of next year. Today on our show, we'll speak with Principal Chief Chuck Hoskin Jr. and a tribal Medicaid consultant on the potential changes to Native health care. And later in the hour, we'll also hear from a Yupik leader who won a prestigious environmental prize for her advocacy related to a controversial open pit mine in southwest Alaska. You can join this conversation today. Just call us at 1-800-996-2848. That number is also 1-800-99-NATIVE. Joining us now on Zoom from Tahlequah, Oklahoma, is Chuck Hoskin Jr. He is the Principal Chief of the Cherokee Nation. Principal Chief, always a pleasure to have you on the show. Welcome back.
CO, my friend, good to be back.
CO. Also joining us on Zoom from Shawnee, Oklahoma, is Yvonne Myers. She is an Affordable Care Act and Medicaid consultant for Citizen Potawatomi Nation Health Services. Yvonne, welcome to Native America Calling. Great to have you on the show today.
Thank you, Sean. It's a pleasure to be here.
Absolutely. Well, Principal Chief, I want to begin with you because in an op-ed for the Cherokee Phoenix, you say state elected leaders are on track to reverse one of the most important health care initiatives in Oklahoma history. Just how significant has the state's Medicaid expansion been for Cherokee Nation?
Well, it's been a game changer for a couple of reasons. First of all, just like any other Oklahoman, Cherokee citizens in that income bracket that's still very low, but wasn't low enough to qualify for Medicaid, got access to health insurance. And yes, we have an excellent healthcare system in the Cherokee Nation, but if you have insurance, you have options and you have the security for your family. And in some cases, it may be a mixed family of Native and non-Native. And so there's that reason it was important, first and foremost, health access. But the other reason goes also to health access, but in a way that takes a little bit more explaining. Third-party revenue, that is the Cherokee Nation's health system, as any health system does, charging an insurance company or charging Medicare or charging Medicaid. In this case, brings dollars back into our health system. And I'm telling you, and this is what I told the legislature, every penny goes to doing things that we all care about if we care about healthcare. And that's all of us, which is expanding healthcare facilities, hiring more healthcare professionals, expanding services, and in the case of the Cherokee Nation, doing things that are even beyond the, I think, very obvious things you do to grow a healthcare system, which is to fund education for our people to get into healthcare, fund wellness infrastructure and programs. And so that was boosted by Medicaid expansion, and we've measured it. We get about $162 million every year just in that third-party billing. And so when I tell you that every penny goes back into all those good things, that's $162 million. We also measure the economic impact of it because, there's two reasons I think to support Medicaid expansion. One's the moral case that everybody deserves access to health care without bankrupting themselves or having to do without. But there's also a fiscal and economic impact case, and we measured it as $222 million every year generated by that spending. And so it's been very important to us, and the destruction of Medicaid expansion will be detrimental to us.
Okay, I'm glad you mentioned the economic benefits and impacts that are at stake here as well. So the legislature's push to undo the state's Medicaid expansion, this comes, of course, as federal cuts and restrictions to the program also loom. So ultimately, what do you see the effect might be, not just in terms of healthcare, but also the economic issues that you're discussing?
Right. So we'll go backwards in ways that the state of Oklahoma shouldn't be going backwards on. So first and foremost, we always need to start with the individuals who have gained health care insurance and therefore gained health care access and the improved health outcomes that can come with that access. 250,000 Oklahomans will be thrown off their insurance, and anybody who's experienced life without health insurance and without other means, and our tribal health system, of course, provides that means to the people who can access it, understands what I'm talking about. You're in a precarious situation, and as it turns out, this is very obvious. But whether you have health insurance or not, you will get sick, and you could get sick in a catastrophic way. And lack of insurance can devastate a person personally. So that is what is at stake. But if you just take the Cherokee Nation's healthcare system, and I shared those numbers a moment ago, let me revisit them. We alone in our health system, and it's a big health system, but there's other health systems in the state, bill $162 million. We turn that into expanding healthcare, and we turn that into those dollars rolling around mostly in rural communities. This is really important. When we're talking about a tribal health system, you're often, almost always talking about a rural area. That's economic impact for rural Oklahoma to the tune of $222 million from us, our activities. 1,400 jobs are supported or created because of that spending. So if you extrapolate that across the state, I don't have numbers for the whole state right now, but if you consider that what I just shared was just Cherokee Nation, we've got other major health systems, including other tribal health systems that, again, are operating in rural areas. So I'll just put it plainly, the rural economy in Oklahoma is going to take a kick in the teeth if Medicaid expansion is terminated. We're also going to see, I think, more closures and a greater rate of contraction of access to rural health care for everybody because a lot of these non-native clinics are sort of operating on the margins, and I'm just afraid more are going to close.
Okay, now, the governor and elected officials in the legislature, they say the state can't afford to continue the extended coverage on the level it committed to back in 2020. Can an argument be made that the state should be able to adjust based on the changing national political environment? What's your thought?
Well, yeah, and let me try to break that down, at least from my perspective. So there's a few things going on. First of all, no one can tell me that the state of Oklahoma lacks sufficient resources to fund Medicaid expansion into the future based on the current model or based on even an adjustment. But if you look at the current model, the feds pick up 90%. We're at 10% in the state. This is a state that is every year talking about how quickly they can cut income taxes. They're talking about cutting property taxes. That's a fine debate, but it's not consequence free. And so the state this year says, well, we'll need $500 million to fully fund the Oklahoma Healthcare Authority to pay for this, in part, this Medicaid expansion. I think the dollars are there. I think what's lacking is the will. The same legislature that has been happy to reduce revenue is not or is really saying the sky is falling on Medicaid when the sky is not falling. Now, what if the feds were to change that arithmetic 90-10? Well, the legislature's already proven that they can go to essentially a snap, and I would call it a very cynically sneaky election if they have their way and have this election in August. They've proven that they can move quickly to take something to the people to decide a question. I say let's wait to see if the feds do back out of their Medicaid commitment before we go dismantling it here in the state. So that's my view there, is we don't need to make this move now. But I also think it's a move led by a legislature that, by and large, not to a person certainly, and not even on a partisan basis, but by and large, did not want Medicaid expansion in the first place, dug in their heels for a decade and refused to enact it. And this is what's important for listeners to understand, that in Oklahoma, the people took this matter into their own hands, put it in the Constitution where it's safely away from legislators whittling away at it or terminating it. And that, I think, is what's really going on here. The legislature would like to get their hands on this Medicaid expansion. And I think, frankly, this is pretext. A group of people that, by and large, didn't want it are now wanting to get their hands on it so they can manage it into oblivion. I just think it's a phony case to be made that the state can't afford it fiscally. One other thing I'll mention is the reason that states are feeling a lot of pressure right now on Medicaid is because the government of the United States, the Congress of the United States, have imposed a lot of cuts on Medicaid that are into the future, and states are naturally worried. So this is not just an Oklahoma issue. This really is a national issue, but I hope this is a wake-up call, what's going on in Oklahoma.
All right. Thank you, Principal Chief. We're going to take a short break. When we come back, I want to ask you more about the federal side of this issue. Of course, they share 90% of the cost sharing with regard to Medicaid. So I've got a question for you, but we do have to take a quick break here. We'll come back, continue our conversation with Principal Chief Chuck Hoskin Jr. Also on the show today, we have Yvonne Myers, who is an Affordable Care Act and Medicaid consultant for Citizen Potawatomi Nation Health Services. And the phone lines are open, as always, for listeners who would like to join us. What are your thoughts with regard to looming cuts to Medicaid? How could it impact you, perhaps, your family, your community with regard to eligibility, and also potentially reduced funding? Maybe less services, maybe hospitals in your area could potentially close. You can let us know. The number is 1-800-996-2848 or just 1-800-99-NATIVE. You can also just comment on our social media platforms. We've got Facebook, Instagram, Blue Sky, and Threads. Those are always available for our listeners 24/7 to interact and communicate with us, or just go to our website as well, nativeamericacalling.com. But again, we're going to take a short break. We'll come back and continue our conversation with Principal Chief Chuck Hoskin Jr. of the Cherokee Nation. Stay with us, folks. We'll be right back.
A traditional plant-based diet program aims to prevent and reverse diabetes among Native Americans. Jensen Yazi's dedication to the Native Food for Life program helped him lose 100 pounds. We'll hear from him and the program's organizers. We'll also talk to Dinesh chef Justin Pioshi about his secret to winning the top prize on the food competition reality show, Chopped. Join us on the menu on the next Native America Calling.
Who protects Indian country? Amerant does. As the only 100% tribally owned insurance carrier, Amerant helps strengthen tribal communities by providing reliable insurance coverage and keeping dollars in Indian country. From property and liability to commercial auto and tribal workers' compensation, Amerant is here to protect what matters. Celebrating 40 years of serving Indian country. Learn more at amerant.com. That's AMERIND.com.
Thank you for listening to Native America Calling. I'm Sean Spruce. We're speaking with a tribal leader today and a Medicaid expert from Oklahoma about potential major changes to health care for Native people in the state. If you would like to join this conversation with a comment or a question, you can do so by calling 1-800-996-2848. That is also 1-800-99-NATIVE. And you can also continue this conversation on our website and our social media posts. Principal Chief Chuck Hoskin Jr. is on the line from Cherokee Nation headquarters in Tahlequah, Oklahoma. And Principal Chief, going into the break, you talked a little bit about the 90-10 current federal match. And just to explain for our listeners, that means with regard to Medicaid reimbursements, the federal government is responsible for 90% of those reimbursements. The state of Oklahoma is responsible for 10% of those reimbursements. And you talked a little bit about how this could potentially, going forward, these changes could take over $160 million away from the Cherokee health system. And the stance, of course, right now from the Trump administration is that the government should not be propping up health care in that way. What do you say to people that carry that message?
Well, what I say to them is there's two cases to be made for any sort of health insurance, but I think we can apply it to Medicaid expansion, and that is the moral case. I mean, do we want to live in a society in which, depending on your income, your earning ability, your wealth, will decide whether you get treatments to save your life, extend your life, or just have a basic quality of life that healthcare can give? And that's the moral case. That's a case that moves me. Maybe it doesn't move everybody, but I think there's an economic case to be made that I talked a little bit about in my earlier comments. But here's what we know about everybody. We get sick. The only question is, how do we get health care? If people don't have health insurance, we don't have to guess what happens to them. We've got a body of knowledge of decades and decades of statistics in this country which say that they typically get the least efficient and most expensive health care, and they don't end up paying for it out of pocket. They pay for it in the form of their own poor health, but they are ending up in emergency rooms. They're ending up not getting the sort of wellness checks that most of us get and take for granted. That ends up sapping their productivity. And if you extrapolate that over in Oklahoma, 250,000 Oklahomans, and again, these are a lot of working folks that are on Medicaid expansion, then extrapolate that across the country, you've got a lot of folks who are still getting sick, still getting health care. They're getting in the most expensive and inefficient way possible, and the rest of us are paying for it. That sounds like a rotten way to run a health system to me. And so from a fiscal standpoint, it seems to me and many others that managing this, essentially the risk and the economics of health, is best done through a health insurance pool in which we're all kicking in, and Medicaid is about the country kicking in. This country, I mean, my goodness, I've seen some of the expenditures from the government of the United States, and they've gone up a lot recently, as they do from time to time. Medicaid expansion is not a massive, unsustainable burden for the United States of America. We're the most wealthy country in the history of the world. We ought to be able to do this. I'm just not buying that the federal government should step away. One other thing I'll mention on the state level, this gets into the weeds. It's 90-10 for the state of Oklahoma, except for Native Americans. Then it's 100% versus zero. Yes, the feds pay for all of it, but we're sort of at the mercy of the state's Medicaid policy. But in terms of the big picture, can this country afford Medicaid expansion? I will share with you what I shared with the state legislature. I don't think this country can afford to not have Medicaid expansion. It'll be too expensive if we cut it.
All right, Principal Chief, I want to ask you about the case that you made to lawmakers on the floor of the Oklahoma House of Representatives, and you described the importance that the expanded health care coverage has for the state. That ultimately got you barred from that appearing in front of that body going forward. What message do you take from that action?
Well, I think, first of all, if a person has to get banned from the state of Oklahoma's House of Representatives, you might as well go down swinging. And maybe that's what that was. But I think the most important thing is that if it got attention, hopefully it shines a light on the issue of Medicaid expansion. Hopefully it shines a light on the 250,000 Oklahomans who are at risk of losing health insurance. A little bit of context. I have spoken there every year that I've been chief. I'm now in my 7th year, every year except when COVID shut everything down. I've always spoken on an issue of public policy. I've spoken on missing and murdered Indigenous women. I've spoken on tribal compacts. I've spoken critically at times about the governor of the state of Oklahoma. This time was no different from my perspective, and I was speaking on an important issue, and I didn't go scorched earth. I think if anybody listened to what I said or read what I said, they couldn't honestly say that I somehow went in and took cheap shots. I laid out a case, and all I said was, I know you're concerned, legislators, about the fiscal impact, but I think the state can't afford to cut Medicaid expansion. I think that I don't think every legislator felt the way the speaker felt, and I think the speaker is a decent man. Has been a friend. I think that moment was particularly uncomfortable for some members of the House of Representatives because I'm not the smartest guy in the world. I'm not the most articulate guy in the world, but I did get a chance to lay out from the podium, I think, some facts and analysis that don't get discussed enough in that chamber by somebody who's not a partisan guy. And I mean, my job as chief is not to be partisan. So I think it just sort of hit him a little close to the mark.
Principal Chief Chuck Hoskin Jr., really appreciate you taking time to educate our listeners today. Thanks so much.
Thank you, sir.
Yvonne Myers is our next guest. She's an Affordable Care Act and Medicaid consultant for Citizen Potawatomi Nation Health Services. She joins us now from Shawnee, Oklahoma. And Yvonne, we heard from Principal Chief Chuck Hoskin Jr. with regard to what's happening potentially with the Cherokee Nation, but what are tribes like Citizen Potawatomi doing right now to shore up health care coverage for tribal members in response to these potential Medicaid cuts?
Good afternoon, Sean.
Okay, Yvonne Myers, we're working on getting her back on the line here.
Overstating it. Can you hear me?
Yeah, I can hear you. You're fine. Go ahead, Yvonne.
That we would be expecting at least a 50% reduction in our Medicaid revenue. And as Chief Hoskins mentioned, everything we bring in from third-party revenue, and Medicaid being our best payer, goes back into the health system. And so we are looking at making sure that we are there in the clinics to assist all our members that come through the clinics with keeping their eligibility in place. We have a very active patient benefit staff, and we work very hard to make sure if they're eligible, they keep it in place. We're looking at trying to educate our members, but it is a concern, and loss of this income could potentially reduce some of the expanded services that we've been able to put in place as we've reinvested into it. It will increase services that we have to refer out, and we call that purchase and referred care. Some tribes call it contract health services, but for some services that our tribal members need that we can't provide in-house, we have to refer them out for care. And what we saw with the implementation of Medicaid expansion is that our purchase and referred costs went dramatically down and our revenues went up and our members got access to the best of care. And there's a wonderful host of services available through the IHS and tribes and urban Indian clinics. And we just want to make sure that our tribal members and their families have access to the best care that they can get.
Okay. Yvonne, there was a study that estimates that federal cuts could potentially cause some close to 450 hospitals to close around the country. Now, this source does have an agenda, but even let's say it's half that number. Let's say it's 225. That's still a significant number of hospitals to go away. Do you have any predictions for where the changes to Medicaid will be felt the most, though, since there's so many working parts with the Medicaid program?
I would say that, I kind of reviewed this. In Oklahoma, we have 165 hospitals, and 90 of those are considered rural hospitals. And Oklahoma is currently considered the state with the highest number of vulnerable rural hospitals in the nation. And as was previously mentioned, a lot of these hospitals and clinics are operating on a razor-thin edge on trying to make ends meet and keep it into play. The latest information that I saw was that there are 47 hospitals in Oklahoma at risk of closure, and 23 are at risk for immediate closure. And during the past week, We just had an announcement from one of our large healthcare systems, Integris, that they will be cutting back significantly because of the anticipated losses of Medicaid revenue. And they will be closing clinics and reducing staff. And so there's already evidence put out there that Chief Hoskin mentioned that we will be losing that infrastructure across the state, and that's significant.
Mm-hmm. Yvonne, you mentioned earlier that you folks are providing some educational outreach so that community members understand what these potential changes could mean. And, one thing I've really learned over the years is that Medicaid policy is very, very complex. It can be difficult to understand. So I'm interested in learning more about your outreach and what you're able to do in order to properly educate and inform community members who might not have a lot of time to spend educating themselves or being completely up to date on what these changes might mean.
Well, I will say that it's a work in progress at this time. Oklahoma tribal policy staff have been very active on a national level with our CMS Tribal Technical Advisory Group. It's called TTAG for short. And we work very closely with CMS, and we have been effective in getting CMS to provide some exemptions from some of the changes that the HR 1 or the Big Beautiful Bill, whatever you want to call it, are going to bring forth. And part of that is to get good educational materials put together. So I think all of us are working on how we're going to do outreach. We have different modes through newsletters, through podcasts, through clinic where we can hand out materials. But I will say that we are working on that at this time.
Okay. I also want to ask you the same question that I asked earlier to Principal Chief Hoskin. Is it the government's place to ensure tribal healthcare enterprises remain viable? What's your take, Yvonne?
Well, I've had the opportunity to work with the tribes since 2013. I retired from public health and working in the state. And I would say what I've learned in the trust and treaty that the United States has fallen short of what they should have done for our tribal nations. And I do believe that there is a responsibility there. And what I've seen during this time is funding has never been at a level that met the need for our Native members and Alaska Natives. But they also encouraged us to do third-party billing, and many tribes have done that and brought that in, and we're working very hard on that. But when you're taking away these opportunities to bring in the revenue, I think that leaves us vulnerable again, and it feels like it's another place where we're stepping away from the responsibilities.
Okay. Yvonne, states, of course, are taking different approaches to these potential cuts. What do you think for most Native people, where will we ultimately feel the consequences of federal Medicaid cuts? Will it be with reduced services? Will it be with fewer hospitals to access? Will it be with referrals that don't get paid or don't get made? Again, I just think there's so many different ways that this could impact different people.
Well, John, you covered a lot of them right there, but I'm going to give you one example. With Medicaid expansion, prior to Medicaid expansion being approved, dental services for the adult population were limited to emergency extractions only. And with Medicaid expansion, Oklahoma put a comprehensive dental services benefit in place for everyone that qualified. And knowing, you go from emergency extractions to being able to get your preventive care and their ongoing needs to get your oral health in place was huge. And if you talk about taking that away, there goes the whole dental component that we had before. So behavioral health has been expanded. The drug and substance abuse has been expanded. And when you look at taking away optional services under the Medicaid plan, it harms and takes away some of the benefits from keeping our tribal members and Oklahomans healthy.
Yvonne, you're an Affordable Care Act and Medicaid consultant. And again, you serve the Citizen Potawatomi Nation Health Services. But I'm interested in knowing more about your career and what all goes into being a Medicaid consultant in addition to staying up to date with all of these policy issues and advocacy work that you do? What's a typical day like for you in terms of working?
Well, I will say that if we were on camera, you would see white hair. So I've been around this for a long time. And so I don't work full time, but what I do is I run the Affordable Healthcare Insurance Sponsorship Project for Citizen Potawatomi. I also work on their state and national policy. And the biggest thing, and then when we have tribal members across the U.S. that are having issues, our tribal leadership will ask me to call and see if I can assist with that. And so it can range from anywhere from assisting them with getting them on Medicaid, assisting them with getting them on Medicare, and it also looks at the special provisions for American Indians and Alaska Natives in the affordable healthcare marketplace. And so oftentimes we can get someone enrolled as a Native American Alaska Native. You have an open enrollment in the marketplace. You also have the ability to, with the tribal referrals, to have all copay and deductible costs waived. So what I look at is, how do I give people the most access to care, access the services they need, keep tribal costs down where possible, and raise the revenue for our tribal nation.
Okay, one more quick question, then we have to go to break. What have been some of the most significant Medicaid changes that you have seen so far, especially since 2020?
I would say for families, because as the chief mentioned, a lot of our families are mixed families. So you have Native and non-Native families, and where our Native members were able to access care through our tribal systems, then their non-Native spouses and family members may not have had that same ability to access services. And just hearing the feedback from our families saying, oh, I spoke to one woman when I told her about expansion starting, and she said, you mean my husband can actually get his shoulder operated on now? And I said, yes, we'll get you enrolled and he'll have access to the full array of health services through Medicaid. So,
right.
And that has been echoed time and time again.
Okay. Thank you, Yvonne. Really appreciate you taking the time today to talk with our listeners. Yvonne Myers, Affordable Care Act and Medicaid consultant for Citizen Potawatomi Nation Health Services. We're going to take a short break. We're going to come back and we will introduce a new guest, a Yupik leader who recently won a prestigious environmental prize. Stay with us, folks.
Tribal Development Partners, helping tribes build toward their goals through 105L leasing and essential facility development, empowering sovereignty, strengthening community. More at tribaldevpartners.com, proud supporters of this show.
Kaufman & Associates has over 35 years of experience serving Indian country, supporting growth, transformation, and sustainability of tribal programs. More at kaufmaninc.com, KAUFFMANINC.com.
You're listening to Native America Calling. I'm Sean Spruce. We want to take time now to talk with Yupik advocate Alannah Hurley, who recently won a National Environmental Award for her work. You can listen to this show and past shows on our website, nativeamericacalling.com, and all major podcast platforms. Joining us now is Alannah Hurley. She is the Executive Director for the United Tribes of Bristol Bay. She is Yupik. Good morning, Alannah, and welcome back to Native America Calling.
Hey, good morning. Liana, for having me.
Absolutely. Well, I want to congratulate you. You were just awarded the Goldman Environmental Prize for your work to preserve the Bristol Bay region and halt the proposed Pebble Mine project. This is a mine, primarily gold and copper. Tell me more. What does this recognition mean for you, Alannah?
Oh, well, thank you so much. This was really humbling. While I was extremely humbled to receive the award, it was really a recognition and a testament to the work and dedication of so many people, our folks at United Tribes of Bristol Bay, our tribal leaders, our people, and our region who have just not given up over the last 20 years to protect our culture and homeland.
Now, you've taken on the project in the courts for years. It's currently stalled. in 2023. Opponents to the mine, you won a major victory with the EPA blocking it. Tell us where the project stands now, though, with the new administration.
Yeah, that's a really great question. You know, after 20 years, we were able to secure those EPA Clean Water Act protections. The state of Alaska and the Pebble Limited Partnership sued, and so those are currently in litigation with oral arguments set to take place this summer. And so Pebble is definitely not giving up. And in addition to Pebble, there are actually over 20 other active mining claims throughout our watershed. And so while we've made amazing progress, we still are in this fight for the long term, not only defending those protections in court, but working to secure watershed-wide protection.
Okay, and tell us more about these watershed protections. I know there are salmon at stake. What are the other environmental concerns with regard to this potential mine?
Yeah, you know, I think you can't change the type, size, and location of the Pebble mine, and this type of mining, copper porphyry mining, hard rock mining that generates acid mine drainage and tons of toxic waste to be stored in perpetuity within our watershed would just have devastating and irreversible impacts on the water. And we're extremely blessed and lucky to still live in a very pristine place. And all of our water is obviously very connected. And so anything that happens to the water will devastate all the animals and fish and our people, because we still are able to hunt and fish and gather like our ancestors have for thousands of years.
Alannah, you're in the Bristol Bay area, which is, of course, near the Aleutian chain. But for our listeners that might not be as familiar with Alaska, give us a little bit more background on this region of the country and what's so special about it.
Yeah, we are just north of the Aleutian chain in southwest Alaska. It's about an hour-and-a-half flight outside of Anchorage, Alaska's largest city. We don't have roads that connect our communities. We have about 25 year-round communities throughout the size of Iowa is about Bristol Bay proper. And in Bristol Bay, we have 3 different indigenous peoples, the Yupik people, the Alutiiq people, and the Dena'ina people. Very different culturally, very different languages, but still able, like I said earlier, to live a subsistence way of life as our ancestors have. And so because we still live in our traditional homelands and are able to thrive off our land and waters, you know, this is not only an issue about protecting our culture and who we are and the natural environment, but really an issue, a human rights issue about our ability to be able to continue in our communities, because so much of our people still rely and live on our lands and waters. And so it's a very unique part of the country, but very beautiful, very pristine. Our kids can drink out of the water, you know, out of the rivers and lakes. It's an amazing place.
It sounds absolutely sublime, Alannah. Absolutely. Now, and again, we really just can't understate the significance of this victory for you and the others who have worked so hard to stop this project, or at least delay this project. What's that been like, Alannah, in terms of just how long this has gone on and just the level of stress? Because, of course, the state of the state of Alaska in many ways supports the mine as well. So you're also dealing with, you know, the state of Alaska with that regard. Have there been times that you just felt like giving up? How did you persevere?
Yeah, you know, I think anyone who tells you that they don't feel like that is lying, especially over such a long period of time. But, you know, I think because this is such an existential threat, our people don't have the choice to keep fighting. It's really a battle for who we are as Native people, a battle for our homeland, a battle for our future kids and generations to be able to continue to be Native people in our home. And so when something so sacred and so much is at risk, you really have no choice. And so I think what has helped us persevere is really staying grounded in who we are as Native people and remembering that this fight for us is coming from a place of love. It's really hard not to get caught up in anger and the injustice of of a lot of these fights, but we're here fighting because we love our home, we love our people, we love our ways of life, and they're worth protecting and passing on to the future, so our people can continue to thrive here. And so at the end of the day, when something so sacred is at risk, you really have no choice.
Alannah, what's really remarkable here is that your involvement here goes back more than 20 years, the early 2000s, and you would protest and organize against the Pebble Mine when it was first proposed way back then. What was the spark for your initial advocacy work?
Yeah, it was really kind of coming to be around the time I was graduating from high school. And so, in our culture, you're really raised to care for the land, the water, for other people in your community. It's really instilled in you from the time you can walk. You're sharing what you hunt, you're sharing what you gather, you're sharing what you fish with people who can't fish themselves. We're taking care of each other. And so, I think the inspiration, I get asked this a lot actually, is really is just that I've been so blessed to be raised in our traditional values in our communities. And when you're raised from a very early age to care about the land and care about the water and our people, that was really, the inspiration, I think, and why our region has been able to sustain this fight for as long as we have. Those values have just really been the foundation of our fight to protect our home.
Alannah, United Tribes of Bristol Bay is a consortium of 15 Alaska tribes in southwest Alaska. And I read in one interview that you did in which you said some of these groups, traditionally didn't get along and they were not always allies. So what's that been like, working with these different tribes, environmental groups, all related to this one issue, and getting everyone on the same page, getting everyone united?
Yeah, I feel like it's been our biggest challenge and the most rewarding part of our work. Like I said earlier, we have 3 different indigenous groups, many different tribes within those groups, and uniting people, figuring out where to go to dinner with a group of people is really hard. But sustaining this unity over the long term is one of our biggest victories. And I think beyond even uniting our people, but empowering our people and people who feel invisible to hold the government accountable and their trust responsibility to our tribes, like that is just invaluable in terms of what we've been able to do. And I think uniting and working with people who don't usually get along outside of our Native communities, commercial fishermen, sport fishermen, the environmental community, at the end of the day, that's really about personal relationships and working through really hard moments to really push for respectful, reciprocal relationships with these different groups. And so with a country that's dealing with such polarizing politics, I feel like, what's happened in Bristol Bay is an amazing example of what you can accomplish if we can find common ground and work together.
And Alannah, the people who support the Pebble Mine project, and some of those are Native interests who see economic benefits potentially. How are conversations? How have they evolved as well when you talk to those folks?
I think when it comes to our people in Bristol Bay, those conversations have never been about disagreeing about the need for the diversification of our economy and creating jobs where people can survive in a cash economy. That's just a modern reality. But I think, where we differ is how we get there. And for the vast majority of Bristol Bay, our culture just doesn't have a price tag, and some things aren't worth risking for money. And so really, I think moving from a place of we don't actually disagree, we agree that we need to do this, let's find ways that we can sustainably develop and make sure that we are creating jobs in our communities and we are creating economic opportunity in ways that honor who we are as Native people and our ways of life and will help us be sustained into the future for the long term. And so, I think that's the challenge moving forward. And we're so thankful we've made great progress because it really, opens up air for our region to be able to focus on building those critical things for our communities.
I want to ask you about the role of the Trump administration here going forward, because this EPA block, I mean, that was ultimately a favorable decision that the Trump administration was involved in. And yet, I've read that you have concerns about the unpredictability of the presidential administration right now. And recently, President Trump issued an executive order saying he'll increase mineral production. So what's the sentiment right now among Bristol Bay region residents and yourself in terms of what the future holds with the current Trump administration and which way they're going to break on this issue ultimately?
Yeah, I think it's a little more nuanced. It's been quite the roller coaster across different administrations. And so currently, you're correct, the Trump administration is defending the EPA protections in court in that litigation. But, as you stated earlier, because this administration has continually proven that it's pretty unpredictable, our tribes are very much not putting all of our eggs in those baskets and definitely looking at different layers of protection on the federal side, on the state side, to really ensure that our kids aren't going to be stuck fighting proposal by proposal from now into eternity. That is not a future we want for our children. And so, I think as of right now, we're in court defending those protections. Regardless of what the administration does, we'll be working to defend those protections. But I think our region has proven over time, regardless of the politics, our position does not change, and our work to secure permanent protections for our people perseveres and will continue. And so while it's unpredictable, I find hope and sleep better at night knowing that our region is so rooted in their dedication to move this forward.
Okay. And Alannah, if at some point in the future EPA protections, those do get stripped, what do you anticipate will happen? What will be the result in the most concerning possibility for you?
In the event that they were withdrawn again, because that actually did happen in the past, we would obviously probably, take any recourse we could to try and have them reinstated. And so that could include litigation, that could include, legislative action. Our coalition and our tribes have proven that we will literally go to any length to secure these protections that are needed. So while I hope that does not happen in the future, because it's really just, it's only been used 14 times, and Bristol Bay was the 14th time that the EPA used this authority under the Clean Water Act. It's really just a testament to what's at stake here, and that the fact that we're going to continue, and that opposition has not wavered over the last 25 years and is only going to continue until we have permanent protections.
Alannah, I want to congratulate you again on the Goldman Environmental Prize. And in another interview that I read, you said really you feel that this is it's not just you, but everyone else who has been involved in this fight all these years. All of you folks are deserving of this prize. But for you specifically, what's been the biggest highlight of your career and this work that you've done, the advocacy and the protection that you've worked so hard for?
For me as an individual, it's really watching people in our communities be empowered to use their voice when they feel invisible, and seeing actual progress when they do. And so being able to watch our people be empowered to self-determine our future has been invaluable to me, and why I continue in this work. Because at the end of the day, our power really comes from our people, and our outreach and ed on the ground is just as important as government-to-government consultation. And so really at the end of the day, it's about seeing people who feel invisible and voiceless feel empowered to advocate for a future that they want, regardless of the odds. And so that continues to motivate me, and I look forward to doing it and helping be a part of that in any way I can.
Alannah, thanks again for coming on the show today. Really appreciate you.
Yep, thank you.
And with that, we're out of time, folks. We're going to have to wrap up this discussion. But of course, I want to thank all of our guests who joined us today: Alannah Hurley, Yvonne Myers, and Principal Chief Chuck Hoskin Jr. And don't forget, tune in again tomorrow for The Menu with Andy Murphy, who will profile a success story with a Native Health initiative. I'm Sean Spruce. We'll talk again soon.
Tribal colleges and universities support their students in countless ways. They say I believe and offer help before it's asked.
Hear that? That's everything tribal college faculty do for their students on Fast Forward. Because if one tried to say it in real time, they'd be here all day. They teach, guide, comfort, and connect. And for that, the community is grateful. Learn more at mostthoroughdjobdescription.com. The American Indian College Fund supports this program.
They give extensions, cheer progress, share laughter, create calm, and allow reflection. They inspire hope, share wisdom, guide gently, validate healing.
Every family caregiver could use help finding the necessary resources to care for their loved one. The AARP Family Caregiver Resource Guide helps family caregivers access key programs, services, and agencies in their communities. A copy of the guide is available by calling 877-333-5885 or online at aarp.org/caregiverresources. AARP supports this show.
Native America Calling is produced in the Annenberg National Native Voice Studios in Albuquerque, New Mexico by Quantic Broadcast Corporation, a Native nonprofit media organization. Funding is provided by the Corporation for Public Broadcasting with support from the Public Radio Satellite Service. Music is by Brent Michael Davids. Native Voice One, the Native American Radio Network.